Hi there. I'm Stella O'Malley, a psychotherapist and director of GenSpect. And I suppose I do think mental health has really lost its way in many ways. It's not just gender dysphoria. Gender dysphoria has revealed a real distress in the heart of the psychological industry, which is what it's become, and the well-being industry. And I think it's very important that we realise how difficult anybody who gets into the caring professions, whether they're a doctor, a psychiatrist, psychotherapist, how helpless we feel in a world that is seeking certainty and diagnosis and frameworks and treatment paths and a result, to be faced with the helplessness of some people are very difficult to help, and some people don't seem to be able to be helped. And what do we as a world do about that fact? Hopefully we don't fall into the many examples we've seen here of unethical treatment. But that is, I think, very often the reason why so many people who are in psychiatric professions who do fall into unethical treatment, because they want to help. And I saw a man on the way here, and he was clearly extremely distressed. Like, really, it was kind of horrifying to watch it. And you could see anybody who was walking by didn't quite know what to do. One person got out their phone and started filming. And in a way, you lighten it because you don't know what to do. That utter sense of helplessness in the face of profound mental distress that nobody has figured out what to do. But we are living in a world that's very results orientated, and all the kind of all the services are around the results, and we have got ourselves into a really difficult situation where people are seeking results, and if there isn't results, who's to blame? And so when we look at that and we realise what we're doing to people who are very, very in deep distress and they need help, we need, I suppose, as a profession, whether a psychiatrist, psychotherapist, psychologist, nurse, doctor, we need to start to have the freedom to say, I don't think I can help this person. I don't know who can. I don't think I can. And when we've got the courage and the moral courage to do that, it'll free things up a little bit. But it's going to be devastating for the people who are the recipients of this. And that's not what's happening these days. Instead, people are getting bounced from one person to the next person, from one service to the next service. And that's a real kind of moral conundrum that we are facing, that we need to look at and think, well, that's actually what we need to face. The fact that people are coming to us and we don't know what to do and we're helpless in a world that says you're not allowed to say those sentences. And so I kind of think we do have to lean into that. Maybe the battle of ideas will lean into it. But I do want to kind of give a kind of a shout out of some of the other scandals we've lost our way in the psych professions before. An obvious one would be multiple personality disorder, where, in a time of huge sexual politics in the 1980s and 1990s, there was a kind of a theory, because psychiatry is generally, clusters of symptoms. It's a very incoherent discipline. It's clusters of symptoms, and then there's a theory in hindsight laid onto this cluster of symptoms, be they depression or anxiety or schizophrenia or whatever they are. And so this recovered memory therapy was based on the idea that children had sexual abuse, but they'd completely forgotten about it. And then they had multiple personality disorder later on. And there's an interesting psychiatrist, he's still alive, he's 93, called Paul McHugh. And he had chased John Money around Johns Hopkins Hospital from kind of 1966 to 1978, because he noticed that John Money, who is a disgrace, and I urge you to look him up if you don't know who he is, he was performing and creating this entire clinic and industry around transsexual, at the time it was called, transsexual surgeries. And Paul McHugh was realising that these people were not improving. They were deeply disturbed, very, very mentally ill people who were not improving. And so he followed it, and in the end he got Johns Hopkins closed, and it closed in 1978 as a result of the very bad results of these people who had trans surgeries and did not improve. They just had other sicknesses. By the way, later on it reopened in 2014. But Paul McHugh then went on to become involved with multiple personality disorder, and he was part of the foundation of the false memory syndrome. And he kind of highlighted the idea that this kind of idea of recovered memory was a very dubious theory of people faced with deep distress, and they brought in a theory. And I would say it's very similar to the trans theory insofar as we could easily have false identity syndrome. And we could easily start kind of looking into this. This is a false identity. It's a syndrome. It's a cluster of of symptoms. And I could easily bring up a theory. Any one of us could bring up a theory. I've got the red card. But what I'm trying to do, I suppose, more than anything is, yes, we know there have been many, many medical scandals, psychiatric scandals before. And what we have to do is start facing the fact that sometimes we can't help. And we have a real dilemma on where we go from there.